way a woman experiences childbirth stays with her for life. Not just the moment she meets her baby, but the emotions around it. For a long time, childbirth conversations focused mainly on the outcome. But today, more women are also asking about the experience itself. Can labor feel calmer? Can birth feel more empowering? Are there approaches that allow women to feel more involved, more prepared, and more connected to the process? That shift is exactly why conversations around natural birth and water birth are growing today. From breathing techniques and movement led labor to the use of water for comfort and relaxation, many women are beginning to explore childbirth in a more informed and intentional way. Welcome to the Care Circle, a podcast series by Motherhood Hospitals, your trusted space for expert led real conversations on everyday health and wellness. I am your host Sahiba, and in today's episode, we are exploring natural birth and water birth, a more empowered way to deliver. Joining us is someone who has been closely associated with evidence based natural birthing practices and women centered maternity care. Dr. Sireesha Reddy, consultant obstetrician and gynecologist at Motherhood Hospitals, Hebbal, Bangalore. With over 2 decades of experience, the doctor has supported women through both routine and high risk pregnancies while strongly advocating for safe, respectful, and empowering birth experiences. Doctor, it's wonderful to have you with us today. Welcome to the podcast.
Thank you, Sariba. Thank you for having me here on this meeting today. So, Doctor, before we get into the details, let's start by setting the context clearly for our listeners. When we say natural birth and water birth, what exactly are we referring to in a real hospital setting, and how is this different from a standard delivery that most women are familiar with? So, when you're talking about birthing methods, as you know, by standard, people tend to talk about vaginal delivery and the cesarean section. So, when you're talking about natural birth and water birth, we're talking about an experience where women are delighted to undergo, where their bodies are helped through and supported so that they can deliver vaginally without too much of medical interventions. That is the terminology that we use for when mothers or women opt for natural birthing. Got it, doctor. And from your experience, what led you to take a deeper interest in natural and water birthing, and why this approach is important to you as a clinician? After working for nearly 30 years in obstetrics and gynecology field, Sahiba, I've had the opportunity of looking at two different worlds. I've had a good amount of experience in United Kingdom, looking at how women labor and deliver. And obviously, after coming back here in India and looking at how delivery process and labor process are being offered to women and conducted over here, over years, I've been having this thought process of how do we make it better for women. So basically, it's a birthing experience most of us all go through once or twice in a lifetime. And it is a memory that we hold on for years together. And it is not something that we just push it away, say that, yes, I'm done and dusted type of thing. So I've always been, thinking behind like, how do I make it better? How do I make women feel more empowered? How would they prepare themselves? What is that they can get and achieve this birthing experience is what has been going on behind my mind. And for which, yes, we had created this opportunity over here at Motherhood Hebal, where we offer women these birthing services, where we train them, teach them, and make them understand their bodies, explore what it is about, how to get them ready for the D-Day, and obviously take them to the journey till the end. Love the part where you said, doctor, making it more empowering for the women. Very true. Out there. That is what our main purpose is. Looking at they should not feel helpless or out of control. Those are the terminologies that we had when we had women coming from different areas and where they had experienced birthing. This is what most of the time they keep telling us, that they felt totally out of control. They felt helpless, and it was something that just happened in a fashion where they were not having a word to say about their method and how the process they wanted it to be going through. So we just wanted to bring a change in that. Then we've gone through that. That's great, doctor. So, doctor, there is often some confusion around the terminologies. Many people assume that natural birth is simply another term for a normal vaginal delivery. So, from a clinical standpoint, how would you define natural birth and what distinguishes it from a standard normal delivery? Yeah, so same thing when we are talking about these two terminologies. Yeah, people do consider that, yeah, I'm actually looking out for a vaginal delivery and that is a natural birth. Definitely, it is a natural birth only, but a vaginal delivery that is well prepared, well understood, and then preparing your body with both physical as well as mental preparation and going through the labor process with least medical intervention and also trying to look at how you can cope with the labor pain because obviously any labor is going to be painful. I mean, we're not talking about natural birthing process is going to be without pain. Yes, definitely there'll be a pain, but the techniques that you learn, the processes that you understand, how to cope with that pain, how well you can manage with the pain, with the support systems that we have woven around, is what is that makes a difference between the vaginal delivery and the natural birth.
So, doctor, when you say least medical intervention, what does that mean? I mean, for the audience to
Yeah,
understand.
yeah. So basically, when you're talking about a vaginal delivery as such, when you go into the hospital with either water leak or pains or anything, you tend to notice your labor is augmented, stimulated with medical interventions like drips, medications, or examinations, which would require, depending on the clinical situation, and leading to, probably an experience that you might not would want your body to go through. So sometimes when you tend to notice that people tend to interfere very soon with the body's, dynamics, how they're going through. I mean, I'm talking about the medical interventions we're talking about. So what we are trying to look at when we say least medical interventions in natural birth is we try to let the women go through their journey in the pregnancy till at least their optimal gestation time period that they complete, which is closer to 40 weeks plus or minus few days here and there. And we would try to evaluate them and see how their process are going through, how well they're preparing themselves to get into labor naturally without least interventions. Still, we do find a group of women will require some sort of interventions, but we try to keep it as minimal interventions where medically we don't need to probe them and prod them a lot. So that way we try to keep it simple. So with these least medical interventions, they'll be able to be flexible. They'll be able to move around in labor a lot. They'll be able to, take control of their pain relief using different mechanisms that are available with us. Pain relieving options like breathing exercises, aromatherapy, water. We're talking about the water burst, the hydrotherapy that they use. Those are the things that they use to help them control their pain. And obviously, a support team that works around the doulas, birth assistants that will be working around with them will help them greatly in achieving this control.
Understood, doctor. So, doctor, would it be fair to say that natural birth is as much about the quality of the experience as it is about the outcome?
So when you're talking about natural birth, quality as well as the outcome both matter a lot. And first and foremost thing is the safety we talk about. So all these women who are taken through the natural birthing processes are carefully screened for, understood that they do not have any underlying medical conditions or underlying conditions through the pregnancy-related conditions that need more supervised care, more monitoring that has to be done onto the baby or the mother. And those are the women that are looked out for, screened out for, and identified as majority of the women who are low risk are the ideal candidates to go in through this process. So safety does play a major role. We take care of all the safety precautions. That is the reason we would want women to try this out in a hospital environment rather than trying it out in their own home settings and all that stuff. So when in case of a medical emergency, the help is available immediately. There's no delay in the help.
I think that's very important.
Very important. True. Very true. Yeah.
So, Dr. Waterworth has specially captured attention in the recent years. So, from a clinical and practical standpoint, what makes water such a supportive environment during labor, and why are more women actively opting for it today?
When you're talking about, I think there's a lot of awareness that is coming around this water birth of late cyber. It's been in the medical practices for quite many years. We've been hearing about water birth, but off late through the media exposure, and I think few of the celebrities who have gone through water birthing processes, they've actually been, highlighting it on the media. Visibility has become much more on these things, and people are coming and asking for these things, whether the services are available and all. And obviously, they are well read in through these things. They do not come in just not understanding. They've gone through that. They've understood what the process is, what are the complications, what are the risks associated, whether, they'll be supported through labor, how is it and all. And when you're talking about water and the benefits of water is, it's a very, lukewarm water that is used for, and it creates a lot of calming environment for the women. Once they enter into the tub, they find that the pain relief is optimal. They tend to get at least 50% of the pain is gone off. And the buoyancy of the water also helps them to feel their bodies become lighter. They're able to, move around in the water pool a little bit at the extent where their muscles do not become very stiff and all. And they do enjoy the birthing process as the process goes through, because there's a lot of ease on the baby's descent and get through the process very quickly and very easily. And also, we've also identified that this birthing process in water helps the perineum to tear less. We've seen the perineal tears, the vaginal tears and all are very minimal. Obviously, the preparation that goes into them, where we tend to teach them how to prepare their perineum or the vaginal part to be stretching less. But then, obviously, water helps them to ease off that discomfort and ease off that, make the tears much better, actually. And the journey for the baby, because it is transiting from the water into a water which is more or less neutral to the body temperature, finds it very calming and easier, is what they say.
I think that fear of the discomfort into a soothing experience, that is
That
what
changes a
makes.
lot. That changes a lot. Yeah, that's what, when the minute they are in the pains and all, and when they put them in the pool, the first thing that they say after the delivery is it's magical. This is a word majority of the water birthing women have used this word. It's magical. I would want to sit in this pool for a little longer. Even after delivering, they would want to sit back because they feel it's so comfortable and so soothing, actually.
That's so great to know, doctor. So, doctor, in your practice, have you noticed a broader shift in how women approach childbirth today compared to a few years ago?
Definitely, since my years of practice that I've been seeing as such, I've been noticing women are becoming more aware of what are all their birthing options are. Not just the type of delivery that they do, they're also being aware of how to feed the baby, being cord clamping, delayed cord clamping, when to, what is induction, how does the processes go on. There's a lot of understanding of when things are being offered for and how they have to be done. And most of the women are now coming out with a birth plan when they're coming in, during their consultation, saying that we would want our labor to be like this. And they are looking out for supports, labor support, like they would want their partners to be with them. So there's a lot of awareness. Even the couple, both of them, they're saying that can I support my wife in labor and all. So there's a lot of shift when you're talking about people were thinking about delivery is just a medical process. I go into the hospital, just deliver and come off. That's it, job done and done. Now they're preparing themselves well. They're understanding how to be prepared for the day that they come in through. And they do have all these interests about delayed cord clamping, skin to skin contact, first feeding initiation. Yeah, there's a lot of things that people are getting to know about what they can opt for.
That's quite a positive change that has happened.
Definitely, definitely over the years.
So my next question is, doctor, the most common concern is about the pain management. So there is a perception that natural birth involves significantly higher levels of discomfort. How do you address this concern when counseling the patients?
Yeah. So, how we go about this is definitely the only terminology that we say is like labor when we call about it's a labor pain when we say they are definitely associated with pains. But what we try to look at in this birthing process is there's a lot of techniques that are taught to them to how to cope. Visualization is something that we start off in, very early weeks of their later stages of their pregnancy. So they tend to understand what actually happens to their body, how the pains come, how to cope with the pain, what are all the breathing techniques that they can, look into while the pain is there. So they're already taught, they've already gone through that phase in, like an imaginary situations and all. And when they come in through that, because of their experiences that they've gone through and their preparation that they've gone through, they tend to simulate that in actual situations also when the labor happens. So most of the women we have gone through in our birthing process in the natural birthing unit, they've coped beautifully. I mean, they've surpassed our expectations. I do have some examples that I'll be quoting to you later on in our conversation. And I found that when women have so much of strength in them, why are we trying to offer them unnecessary pain relief when we talk about an epidural and all this? To say our anesthetists are very unhappy with us because we've cut down our epidural rate to, literally 25% of our epidural rate has, come through now compared to what we were using and what we were offering earlier. So they have become jobless, not doing any epidurals. That's what they keep telling us. So jokes apart, it is like that is how the women are. Actually, there is a lot of strength in us where we don't even tap it. And we find that these women do it so beautifully well with all these supporting systems that are available for them. Actually, I love the imaginary part, like, how you can imagine what you will go through, and that will help you cope with it in the future. I mean, through the breathing techniques. What usually ask them to visualize the labor. Yeah. Usually ask them to visualize their happy, comfortable zones that they can be in spaces and all. So when the labor pain comes, they keep going through them. It's like a little hypnosis type of thing, is what we say. It's not like total hypnosis, but they tend to prepare themselves. They use this music and they use this aromatherapies and all that we provide. So they tend to calm themselves down and they tend to get them into control. Beautifully, they control themselves. So, doctor, another important aspect is safety. So, if a woman begins labor with the intention of having a natural or water birth, but complications arise, how seamlessly can medical intervention be introduced here? So, the beauty of having this water birth in a hospital setting is, in case when there is a medical intervention needed, there will be no delay in the delivery of the services, is what we look into. And the SAIBA, even though a woman is being registered for natural birthing or water birthing experience with us, you always look into how they are at the end of their gestation. That is, when they're finishing a pregnancy, are they still the ideal candidates? Has anything changed in their pregnancy, be it with the baby, be it with the mother? We always evaluate that at each and every step. Anytime we think that so things are getting diverted and things are diverging from the root of what we had chopped out for them, we tend to discuss with the couple saying that, okay, fine, this is how it is going on. We might have to look at a different option for you. Sometimes we tend to have babies that do not turn. Sometimes we tend to have babies that have grown very less, or sometimes we tend to have some medical complications that have tested to the mother. The couple do understand, and then they try to understand the need for more supervised care and they opt for it. At times in labor, when they come in labor, we tend to notice some sort of emergency situations that can occur, maybe with the baby's heart rate pattern, maybe be the position of the baby, or there's an undue delay in their progress and all. And they do understand, okay, fine, when the situation is put to them, saying that we are going to add on, some interventions just because of the safety aspects that are involved, they totally understand that they go through that. But yeah, for last 1.5 years, I would have seen probably 2 or 3 cases out of our natural birthing group, which have been converted into other methods of delivery. And are there any specific categories of patients for whom natural or water birth may not be advisable, doctor? So, when we're talking about medical complications, underlying medical complications, like they're known to have epilepsy, they're known to have medical uncontrolled diabetes, uncontrolled hypertension, these women might not be ideal candidates. And if they have twin pregnancies and previous cesarean pregnancies that would want to have a vaginal birth experience, so these are all, there are a group of women which we would say probably not an ideal candidate to go through this process, but definitely they are supported through the birthing methods in other routes. Understood. And with more women choosing to have childbirth later in the life, doctor, often in their 30s or beyond, how does maternal age influence the suitability for a natural birth? Talking about natural birth, it is all to do with the mind setup, is what I feel, Saiva. It is the strength that the women has. It might be that I might have a 22-year-old who is totally out of control, and I've got a 42-year-old totally composed of and then ready to understands her body well and prepares her body well also. So there's a lot of variation here. So by and large, we do have a tentative figure of, we tend to look at 40 plus and all. We need to be, probably not driving them into this because of their body functionality or associated medical conditions that might be having in them. But we do have some women who have crossed 40 and who have opted, and we found them to be very fit, and we did allow them to go through the birthing process, and they've done beautifully well, controlling their pain relief with all the mechanisms that are available with teams with the natural birthing team, and they've gone through the journey easily. So age alone is not a deciding factor, is what we have identified. It is the wish and it is the strength, inner strength of the woman. It's totally guided by their strength actually. It is so interesting to note that some women with IVF pregnancies are also opting for natural birth. So, from your experience, doctor, what is driving this preference? So, that is always what I think that had surprised me a lot, because we always go through this myth saying that IVF pregnancies are extremely high risk pregnancies and they're treated in a different mode, and they're not given the opportunity of women to go through the birthing experiences and all. We at Motherhood, we tend to, negate that idea. We tend to, guide women once they cross their third month of pregnancy, after the medication support of all that IVF drugs and all are eased off from their body. We tend to ask them to look at their birthing processes as any other general pregnant women. If they do not have any medical complications, associated medical complications, and contraindications for this natural birthing experience, we do encourage them to consider going ahead with the process, work with our teams, and try to prepare their bodies. And we had many of our IVF women opting for this and delivering also. We had couples who've had a rough journey. Basically, when I look back and ask them what could be the reason why they did not want to take a shortcut out and go for elective C-section or any other method of delivery where they would want to, what they have come back to us and told us is they've gone through so much in their pregnancy journey to achieve a pregnancy. A lot of medical interventions have been done, lot of medical drive has been done. They just want to let their bodies take it through naturally, and they would want them to experience what their body, their inner strengths are. That is what one lady has beautifully put it down to be saying that I just want to test what my body can do, because till now I've been so much driven with all these medications and all. I just want to let it go through naturally, because birthing at the end of the day has to be a natural process. It has to come through without any medical intervention. And hats off to her. She pulled off through a 3.8 kg baby so easily in the water, and that was very, very impressive actually.
Wow, I mean, actually, it's very impressive and how powerful, like, that whole approach is.
When we're talking about this, we do have, I was talking about one young girl actually. She was, I think she was in her 26 or 27 years of age group. She literally was going through finishing her gestation. I mean, more or less 40 weeks have been completed, and there were no signs of labor setting in. And she was like hell bent that she wanted to go through the birthing process. She didn't want to miss the opportunity at all. And this girl who actually, went through the process. I mean, obviously, we had to use gentle induction methods for her because she had crossed her due dates and she's gone over the due dates. And she literally went through the process over 30 hours. Not that she was in pain for 30 hours, but she was so, robust. And she was like asking us, what else can I do? What else can I get you through? What all other things that I can do to help me get into labor and all? And we were impressed with her, inner strength. She took the labor process. I mean, the start to end, it was 30 hours of journey. Majority of them in halfway through, they'll give up and they'll say that, no, I don't want to go through this. It's not that she was in pain, but it's just the process. Okay, understanding what it is and giving the time, letting the body sink through a little bit of journey and then taking that break and then going through. And same at the end of the 30th hour, she had taken the baby out of the water and she was literally elated. And we were actually very proud of her. We went and told that, literally surpassed all our, expectations. And we did not even think that she could hold for that long. And she held on it. And she was like pretty much in her, as I said, 26 or 27 years of age group. And taking that much of strength through, it is like, humongous. And it's a hats off with that she could do. It's really amazing. It's amazing when you see their journeys.
Okay, doctor, moving on. So, for someone considering this approach, preparation seems to be the key. So, at what stage of pregnancy should women ideally begin preparing for a natural birth?
So, understanding the concept is a very, very important thing at the start of the pregnancy. When we tend to screen women who are going to be fitting the more or less something around 13 weeks once they finish off their first scan. The NT scan is what we call. We tend to evaluate women when they would be an ideal candidate. We try to give in this idea about the birthing experience that they can look into. So an idea is put into them. So they tend to explore that idea, and they tend to come back to us again around 20 weeks of gestation. Once their anomaly scan, that's the most important scan that we get it done in the pregnancy journey, to be sure that there are no contraindications from our pregnancy point of view, like the baby point of view, to continue with their journey. So once they cross their 5th, 6th month, then we know that pregnancy is stable and there is no holding back of the pregnancy. We tend to ask them to register for this program, where they get to meet the physiotherapist, the dietitian, who will start preparing their diet and who will start looking at their body dynamics and their work patterns, what sort of works they do, whether they are sitting for long hours and whether they are, housewives who are a little bit more flexible. So these are the things that the physiotherapist evaluates and then tries to adjust and tries to streamline, or more or less tailored program is what we call. They tend to work around their working style based on their lifestyle.
So, doctor, I have one doubt because I also come from that category who sit for
It's
long,
hours.
long hours, like, 9, 10 hours easily in
Yes.
the whole day. So, does it anyway, affect
Yeah, when you're talking about sitting for long hours, because most of the women are all IT, they're IT based or any company based and all, you tend to notice desk jobs are, majority of them are opting for desk jobs as of in the current situation. When you're talking about that, the change, how you sit, how you move around also will matter. So, how are you getting the baby into position by your sitting? And if you're sitting for long hours, you need to let your body tend to relax in between. So all these things are looked into. How to do a little bit of physical activity closer to your chair, close your desk. That is what they talk about. We're not talking about giving a lot of elaborate time for preparation of these bodies. We are trying to look at it. How can you, if this is your work style, how can you get your body ready for that? What all can you look into? Okay, what are all the small changes that you can do to make it give you a big, huge impact when the labor process actually starts on. So that is what we have to get them to understand. And during their, whenever their availability of time is there, how they can work out with their bodies is what is being taught to them. So yeah, most of them are actually flexible into this type of methods, and they're quite okay because there's no fixed time saying that this is not a training time, this is not where you have to log on. So there's a lot of flexibility for them. Whatever time they're comfortable with, they can understand when they can practice these things, and they're taught like that.
So, Doctor, could you also walk us through the different aspects of preparation that contribute to a successful natural birthing experience?
The first and foremost thing that we try to look at this Saiba is how the mother looks into her nutrition. First step is the nutritional aspects because we've been looking at there's a lot of myths around this pregnancy nutrition from the families. When you talk about women are fed for two, they're overfed and they're trying to look at women have to gain a lot of excess weight and all is a big huge myth around in our community. So that is what we start breaking them. So first, in the minute they start, showing interest into this birthing experience, we tend to talk to them about what is the optimal nutrition that they'll have to be looking at. What is that they have to divide, how the balanced diet goes on, how it helps both mother and the baby, eventually for a baby to grow well in her womb and the mother to be well prepared for her body. Because there's something called soft tissue dystocia is what we say. There's a lot of excess fat gains in our body will lead to delayed labor, lack of progress in labor and all, and end up most of the women end up having different methods of delivery like cesarean section or any instrumental delivery or medically too much of interference in their bodies because of all these excess undue weight gains. So that's where we first concentrate on giving the right nutrition to the mother. Then the second step is preparing their bodies. So looking at how their bodies are, how are they shaped, what needs to be corrected in their postures or walking styles, and all these things are looked into. Third thing is mental preparation. That is very, very important, even though I say it as a third thing, because you need to prepare them mentally to be strong, to go through this process, to understand their bodies. They should be confident, say that, yes, I'm going to let my body go through this. I'm not going to let anybody dictate terms to me. I'll work with the flow and I'll let them work with me to help me achieve the goal is what. That is what we keep telling them. It is we are there to support you. It is you're going to do the mechanism and deliver the baby. We're there to be around you to help you and assist you.
That's quite a comprehensive approach that is taken, Doctor.
That's true. That's true.
So, given that many women today have demanding work schedules, how practical is it to incorporate these preparations into a daily life?
Yeah. So when they tend to understand the essence of what is it is needed from them, may it be the diet as well as their physical activity and all, I think most of the men we were talking about earlier, the subtle, little small changes that they need to do, they're quite ready to do that. I simply put it down to a common terminology, like when we go back into our elders, how they were delivering and all, they were never having any medical support or preparation going on and all. They were preparing the bodies because their working style was like that. They were throughout the day, they were working into different things in their household chores itself. They were all, talk about all the exercises that we teach are more or less what our grandparents or grandmoms were doing in their regular day-to-day activities. So we tend to tell women that you should not be looking at an elaborate exercise process. Just like short bursts of changes that we do. We tend to put it as a short exercise intervals, like a 5-minute break. You take it, do some sets of body turning exercises that you need to do to let the baby get into the position, optimal positioning of the baby, and changing the pelvic dynamics and all is what we teach them. And because they're very short interval exercises, most of them are able to easily do it rather than taking long breaks and all and worrying about how big preparation it has to be physically. So, majority of them do this very easily.
Got it, Doctor.
And doctor, what role does the support system play over here, like the role of the partner, family, and the medical team altogether? Family does play a major role, Saiba. That is the reason we always encourage women to come with their partners whenever they come for these counseling sessions and preparation sessions. We do encourage the husbands to understand what the women has to go through. And most of the times, husbands are actually supporting the women so well that even if they are giving away, there's a point where they think that their bodies can't cope anymore. The husbands step in and they try to encourage them, give them, they would have grasped some techniques at the point of time when you're in pain or you might have forgotten what you've learned and all. They're all, trying to remind them how to do that and all. Find it so beautiful actually when both work as a team, a husband and wife work as a team to achieve their goal. They achieve, and that is what their achievement is basically. There's nothing that we do for them. It is like we just bystanders looking at how they're working through. And other family members, the extended family members are also very important. They have to understand the concept of it because how they feed the mother, what all the nutritional aspects that are going to take care of the mother in pregnancy, post delivery will also matter a lot. It is very important they also understand the processes along with the couple.
It's quite reassuring to know that, everyone come together and they know it.
That's true.
So, doctor, beyond the clinical aspects, I'm sure there are moments that stay with you as a doctor, like cases that reaffirm why you believe in this approach. So, could you share such experiences with us?
Yeah, so when we look at all these women who have gone through their journey with us, maybe we're talking about these women who have gone through a lot of troubles, multiple IVFs, and then they're coming through the journey and they say that, doctor, I would want to, be as less medically interventional and all and go through and then achieve what they would do. That is very, very, they feel very empowered is what I feel. They feel that they've tested their bodies to their true potential and they've achieved something rather than feeling that somebody's helped them get into being pregnant, a doctor has helped them, and then they've also delivered with the help of a doctor. Here they feel that they have delivered a baby and the doctor was a bystander. So you've got a lot of, whenever we see those happy faces when they've achieved that, and both the husband and the wife are thrilled of what they've gone through and then they've achieved, that gives us a great satisfaction, is what I feel. And when I see women's strength, which we were talking about the earlier, this thing that a mother who could do, a pregnant woman who could wait for at least 30 hours going through the labor process in a different standards and achieving what she needs. These are all, at the end of the day, we feel all the weight and all the this thing that we have gone through with them has paid off, and we feel very, very happy along with them also when they achieve that.
It just feels such an empowering experience for the mothers.
It's totally, that's what they say, that they feel completely strong. They feel that they have done it. They never say, when most of the times, it's not that we have not helped them, but when we look at in the other side of our delivery processes where we do vaginal deliveries and all, obviously there's a lot of push from our doctors when we're talking about when a mother achieves a delivery. And here we tend to be that, okay, but there as a support system, we tend to feel that we see the difference a lot actually.
And my last question to you is, doctor, in your view, what is driving the shift towards the natural birthing methods?
So same thing when I go by, it's not just the being aware of what are all the options that are available, but women of late are trying to look at as least medical interventions as possible for them, as natural as it is that they would want to keep their bodies and their birthing experience also go through. They would want to have, because they're being more aware of when we say about skin to skin care, when we say about the delayed cord clamping, when we say about the breast crawl thing, when we say about the first latching that has to happen within that first 30 minutes and all that stuff. So they're all, well informed. So they would want to go through this experience where they feel, because this is like, as I was saying earlier also, it's one off for most of them. They're not going to do many number of deliveries. They're one off or two maximum by two. They want to carry this experience as a memory that holds on for them for longer rather than just something that's just finished off. So they're trying to look at it as an experience which empowers them, which gives them that richness of what the journey is about, and also gives them the satisfaction. At the end of the day, they feel that yes, they've done it through and they've achieved what they've aimed for. I think that is what most of them are looking out for.
And what is that last golden words or advice you would like to give to other listeners?
Yeah, so all of them, I mean, all the young women who are or who are already in their pregnancy journey, I would say do listen to your bodies and do understand how the dynamics go through. Prepare well is what I would say. Preparation is the key for this birthing experience. Is what, since over years of experience, what I've seen is women who prepare well, whichever method of delivery that they're going to do through, they've done beautifully well. So it's at the end of the day, it's your preparation, understanding your body, preparing it well, doing the right steps, and achieving the goal that you require is what I would encourage you all to try and explore, rather than just trying to shy away from letting your body go through something.
Thank you so much, Doctor. It was truly an insightful and reassuring session for all of us.
Thank you, Saiba. Thanks a lot for that. Let's hope we'll have more of these enriching experiences and sessions we can talk about.
Definitely,
Thank you.
definitely. Thank you.
Thank you.
What today's discussion really reminds us is that childbirth is not one size fits all. Every woman's journey is different, and informed care plays a huge role in helping mothers feel safe, supported, and confident in the choices they make. To everyone listening, especially expecting parents, we hope this episode helped answer some of your questions and perhaps encouraged more open conversations around childbirth choices and preparations. If this episode resonated with you, do share it with someone who may be preparing for pregnancy or parenthood. Because sometimes clarity and reassurance can completely change how someone experiences an important life moment. This is the Care Circle by Motherhood Hospitals. Until next time, take care, stay informed, and keep your circle close.